Welcome to the Protect Your Back class. My name is Felipe Cáceres, staff physical therapist at Zuckerberg San Francisco General Hospital, and together with my colleague Kevin Sullivan, we will cover what is back pain, strategies to protect your back, and exercises you can do to help alleviate back pain. Back pain occurs in 80% of the population at some point in their lives. Many go to women, normally acute, which means it's short term, lasting from days to weeks, and resolves on its own with basic self-care. There are different types of pain, including dull, a constant ache, a sharp sensation, cold or hot sensation, an electric sensation, and numbness and tingling. It can come all of a sudden out of nowhere, or it can actually come gradually and over time. Most of the pain is acute, which, like I stated earlier, it lasts from days to weeks and normally resolves on its own. But I imagine if you're listening to this class at the moment, you might be in the more chronic category, which lasts 12 weeks or longer, and it can still take longer to actually resolve. Most of the causes of back pain are of a mechanical nature, meaning one or more parts of the back are not working correctly together, which can lead to the sensation of back pain. Now, we're going to talk about the major parts of the low back, beginning with the vertebra, the bony structure that actually encases the spinal cord. This bony structure normally begins as a very smooth structure, one stacked on top of the other, and you can have changes within this bone where the smooth edges become jagged and produce these little bony spikes, which can be a source of pain. In between each vertebra, you have an intervertebral disc. Basically, this adds flexibility to the spine, and this gelatinous structure can actually protrude in any direction if it gets overstressed. This is what you refer to as a herniated disc, and when a part of that structure protrudes out in a particular direction, it can actually impinge a nerve. So I want you to think of the intervertebral disc like a jelly donut. If you squeeze it from the front end, what end does the jelly come out from? The back. That means sometimes if you're bending forward a lot and you're trying to pick up many items off the floor, it can cause a disc herniation that pops out through the back that can actually impinge on a nerve, causing a numbness and tingling sensation down the leg. On top of the vertebrae and the intervertebral disc, we have tendons and ligaments. Now, a tendon connects a muscle to a bone, and sometimes if we overstrain ourselves, we can actually injure a muscle or a tendon, which can be a source of pain. Now, a ligament connects a bone to a bone, and it's meant to prevent you from flexing too much or extending your back too much. If we overstretch ourselves, we can introduce a tear into a ligament, or we can overstretch a ligament, and that can be another source of pain. Now, let's talk about the most important structure of the back, which includes the spinal cord and the nerves. I want you to think of the spinal cord as a tree, and I want you to think of the nerves as branches from that tree. So let's say I want to move my foot forward. There's an electrical signal that comes from my brain into my spinal cord, into my nerves, and into my foot saying move forward. That's called a motor nerve. Now let's say I step on a sharp pebble. There's an electrical signal that comes from my foot into my nerves, into my spinal cord, and back into my brain saying you stepped on something sharp. That's called a sensory nerve. Now these nerves have to come out from in between the bony structures that we call the vertebrae. And If there's ever any disturbance within the system, such as the bones impinging on these nerves, or any movement that we might do that puts pressure on these nerves, it can be a source of pain. It can cause numbness and tingling. It can cause a cold sensation. It can even cause a burning sensation that might travel down your leg and affect the way that you walk. So the reason to tell you of all these multiple structures in the back is to show you that the majority of back pain is due to a disruption in the way that the components in the back fit together and move. The good news is, low back pain is rarely caused by something that requires surgery. Routine x-rays are not recommended. First, it doesn't change the overall plan of what we would do for back pain. Secondly, it avoids unnecessary radiation exposure. Sometimes, just getting a routine x-ray doesn't actually pinpoint where your pain is coming from. Surgery is rarely needed. Surgery is only considered when there's a suspicion for cancer, spinal cord injury, spinal infection, severe or progressive neurologic abnormalities, or aortic aneurysms. Luckily, if you are here today, your doctor does not suspect any of these as a culprit for your back pain. Now, the important thing is to keep active and keep moving. Studies have shown that bed rest can actually worsen your back pain. People who have avoided bed rest had better flexibility than those who rested in the bed for a week. Normally, if you ever remember a time when you actually rested in a bed due to a flu or a cold or any other illness, you notice that when you get out of bed after laying down for several days, you become weak, you feel more stiff, you feel dizzy, you feel nauseated. All of this is because over-resting can actually be detrimental to the back health because structures stiffen and your muscles tend to weaken after resting for a long time. So today, in this class, we're going to talk about promoting proper body mechanics in order to keep your spine in alignment, and this, in effect, will help prevent further injury. So the best treatment for back pain is exercise. It does not increase the risk of injury, and it actually will help you get back to where you were before. Helps to improve flexibility, strength, and it actually results in improved pain ratings, which can by itself prevent further injury. So in this next segment, we will be covering posture, body mechanics with movement, and exercises you can do to help work towards a healthier spine.